Hi everybody, Dr. Daniel, and today I'm talking about the different types of migraine, which can be confusing because migraine is found in 12% of the world population and 25% of women have it and 6% of men. So it's something that comes as a genetic familial influence in your life. And it may start with abdominal migraine in some folks. Women have that more than men do at the age of 10 to 20. Or it comes on for some ladies at the time of menopause in their late 40s and 50 years old, which can be a difficult problem. So I want to read a list of the different kinds of migraine headaches I'm going to be talking about today. First, we got migraine without aura, and then migraine with aura, and then menstrual-related migraine with or without aura, pure menstrual migraine, vestibular migraine, abdominal migraine, familial hemiplegic migraine, retinal migraine, ocular migraine, migraine with brainstem aura, chronic migraine, episodic migraine, status migrainosus, weekend migraines, confusional migraine, footballer's migraine, migraine aura triggered seizure, persistent aura without infarction, and silent acephalic migraine. So we'll start with the easiest one there, the most common one there is migraine without aura. And in the old days, that used to be called common migraine because it was so prevalent. And it still is about 70% of all migraine. And these are folks who may have one-sided headache 80% of the time that's throbbing, feel like your heart beating in your head, and they have nausea, vomiting, sensitivity to light, or sensitivity to odors with it. The headache can be moderate to severe. So on a scale of 1 to 10, it'll be 5 to 10, although many patients would tell me in the office their headaches were like 100 or 1,000 or something like that. Kind of joking with headache, but although migraine is not a joke. It may have a time course lasting 4 to 72 hours. It usually puts people down in bed where they can't do anything. All right. Then the next group would be migraine with aura, who have the same features with migraine I've just mentioned, but they may have an aura with it. An aura means a warning of something. And that's usually the auras are visual auras. And these are seeing spots or holes or zigzag lines or half of things. There may be a dark spot like a scotoma where you can't read or see anything, like where your vision is focused on one thing, you can't see or read it. The aura symptoms usually last 10 to 20 minutes, and they should last less than 60 minutes, or the doctor starts working about something else. So the International Classification of Headache says that all migraine aura symptoms are supposed to last about 10 to 60 minutes, and that's it. Then they may have a visual, a numbness feeling like tickling, tingling, or prickly feeling. It comes across the fingers individually that moves into the arm and the face and the tongue on one side of the body. Or there may be trouble talking, which is called aphasia, so that the patient cannot form words very well or talk well, and they can't read well. So that's persons who may have migraine with aura. The next group here would be abdominal migraine. Abdominal migraine is found in folks who are 10 to 20 years old, and women have it more than guys do at that age. And when they're young, they don't really have much headache. They may have no headache or very mild headache. It's not the prominent part. The prominent part is an abdominal feeling of pain, kind of an epigastrium area. They may have nausea or vomiting or just an upset stomach feeling. And this come in an attack that lasts hours or days and goes away. Kind of like a migraine attack comes. And then when they get older, like in their 20s, a significant portion of these folks go ahead and develop plain old migraine. And again, girls have it more prominent, more than men do. All right, next we can talk about menstrual-related migraine with or without aura. Now, these are ladies who may have a menstrual headache, which is defined, excuse me, by the International Classification of Headache Disorder as a headache that comes the day of bleeding, 2 days before, or 2 days after. And these headaches, most ladies will say, are more severe than a usual migraine headache, and they last longer. And with this type of headache, they may have other migraines during the month, different from the next subject, which is pure menstrual migraine, where the ladies only have one pretty bad migraine with their cycle at the time of bleeding, like a menstrual headache, as I've just defined it, but they don't have headaches at other times during the month. Next, we can talk about vestibular migraine. Vestibular migraine is 40% of patients who have this will have a regular migraine headache, as we've discussed it, and then they may have dizziness, off balance, kind of a vertigo feeling. And vertigo means to turn or twist, or that the environment moves. Vertigo is like when you're a kid and you're on a merry-go-round, you get off and you stand there and it kind of feels weird. Next, we can talk about familial hemiplegic migraine. These are folks who have someone else in a first or second degree relative that has a similar condition. And this is a migraine with aura condition, where the aura is motor weakness, lasting again a short period of time. There's certain genetic features for this that make it show the inheritance. They need to have, according to International Classification of Headache, at least one first or second degree relative with the same thing. Next, let's talk about ocular migraine. Well, I really think that word is a misnomer. In other words, the word it's used, but it's not in, it's not condition, it's not in the International Classification of Headache Disorder. So it's kind of like, I feel like, if you want to talk to me, define your terms. And so if you want to define the term ocular migraine, it is not in the International Classification of Headache. It's confused with what was called ophthalmoplegic migraine, which a condition in the first International Classification of Headache way back in time had that condition there, but later it's been moved out. Ophthalmoplegic's moved out because ophthalmoplegic migraine was found to relate to other things. And it's also found with people who have what's called ophthalmic migraine, which is also not in the classification. Let's talk about retinal migraine. Retinal migraine, these are people who've had repeated attacks of migraine with aura. They have that, and then they may have one of these events. And with this, instead of seeing things in two parts of visual images, normally if you have a migraine aura attack, it'll be in the right part of the right eye and the right part of the left eye, and that's called homonymous. Big doctor talk is a phrase that is associated with that. These folks will just have it in one visual field only. And the problem there is, if you talk to patients, most of the time, if you ask them where these objects are in their vision, like those spots or holes or zigzag lights, they will say it's on one side, and they have to really close their eyes and look carefully with their other eye to see that it's in there. And usually when they'll do that, they will see it. So retinal migraine is kind of questionable to some degree because of that. You have to be a really good patient who can tell you the story. And they need to have visual fields and testing and stuff to sort that out. All right, let's talk about migraine with brainstem aura. This is a migraine with aura attack, also with symptoms involving the brainstem. So it causes headache on the back of the head, visual auras, and numbness and tingling on both sides of the body, right and left. This condition was named by Bickerstaff, Dr. Bickerstaff, and it was first called, well, it has a name, but the International Classification of Headache now calls this migraine with brainstem aura. And I'm just going to read some of the symptoms that can be associated with this. These are folks who have migraine with slurred speech, which is dysarthria, sensation of movement, which is vertigo, ringing in the ears, which is tinnitus, double vision, which is diplopia, unsteady when walking, like ataxia, a temporary decreased consciousness, which can be syncope or fainting, and they may have change in the eyesight in both eyes with flashing eyes, and numbness, pins, needle feeling in both arms. Chronic migraine. Well, chronic migraine is also an International Classification of Headache term. That means someone has 15 or more migraine headaches a month, 8 of which have migraine features, and it's been going on for 3 months, as opposed to episodic migraine, which is having 14 or less migraine headaches a month. Status migrainosus, this person has a headache, a migraine that's severe, usually that lasts more than 72 hours. A migraine can last normally 4 to 72 hours. If you have a headache lasting longer than that, that's called status. It means it's there and won't go away. Those are usually severe migraines. Weekend migraine So that comes because migraine becomes in a letdown period of your life. So these have a group of terms associated with it. There's Saturday morning headache, Sunday morning headache, weekend headache, holiday headache, and things like that. These are headaches that come at a time of letdown occurrence. Acute confusional migraine. These are mostly young children who get a bump on their head, and then they'll have confusion, irritability, drowsiness, nausea, vomiting kind of thing, and they get over it usually. Footballer's migraine is a syndrome of seeing visual images, numbness and tingling on one side of the body following an attack of migraine with aura in folks who've had a bump on their head from playing soccer. Footballer migraine is a European term. In America, we have just plain old soccer. The phrase migraine aura-triggered seizure, these are folks that migraine and epilepsy are paroxysmal things that come, affect somebody a period of time, then go away. They're sudden onset, usually go away. Epilepsy attacks are usually quick. And so some folks will have a migraine aura, they'll have a seizure at the end of it, and they need to be treated for both migraine and epilepsy of those folks. Or some people have had an aura, a visual aura, as I previously described it, which lasts too long a period of time, like more than 60 minutes. These are people who've had the aura last about a week or sometimes longer than that, and you scan them, MRI scan, and they don't have a stroke or infarction. So the whole thing is called persistent aura without infarction. And then there's a group of folks who will have a called silent acephalic migraine. This, in my experience, these are folks who are ladies and about 50, 60 years old. They'll come in describing the typical migraine aura. They can draw pictures in zigzag line. They're shaped like a boomerang, little arc type of attack. They last a period of time, just like for a migraine, but they really have never known they've had migraine in their past. And they may have migraine, similar things like sick headache or motion sickness or menstrual headaches that they just treated with, Excedrin or something like that, or headaches that came at night and woke them up in the early morning like migraine tends to do. So those are my thoughts on the different types of migraine. I hope it's helpful to you to sort them out, because there are all these terms that are floating around there about migraine, and it's kind of hard to just sort this out. So please click on like down there and subscribe to my account and follow me. I'll see you again on the next talk.